Hi nurses, this is Manisha, your NCLEX instructor from NCLEX Nepal, and today in this video we'll be talking about one of the most tested topic, that is epiglottitis. So let's begin. Epiglottitis भनेको epiglottisको inflammation हो. Epiglottis भनेको एउटा leaf-like structure हो which is situated behind the tongue and just at the top of the larynx. Now epiglottisको function भनेको यसले during the time of eating airwayलाई seal off गरिदिन्छ so that the food particles do not enter into the lungs. Now, NCLEX will test you mostly on recognizing the signs and symptoms and its priority action. So let's talk about the most probable signs and symptoms that the NCLEX may ask you on how to recognize those symptoms. Now, the first position is tripod position. Tripod position ma you may be asked like a baby is presented with protruded tongue, looking upward with their chin facing up and their hands on their knees. So your position भनेको चाहिँ classic symptom of epiglottitis. So and whenever the patient is presented with such symptoms, your first priority is always maintaining their airway. Another major sign the NCLEX will test you is drooling. So as we have mentioned earlier, epiglottis ठ्याक्क larynx को माथिपट्टि हुन्छ. So यदि त्यहाँनिर इन्फ्लामेसन भएको छ भने it will also affect the esophagus अथवा चाहिँ हाम्रो फुड पाइपलाई पनि असर पुर्याइरहेको हुन्छ. And यदि त्यहाँनिर इन्फ्लामेसन भइरहेको छ भने patient will have difficulty in swallowing. That's why the patient will have drooling, will not be able to control the secretion, and त्यसको कारणले गर्दाखेरि चाहिँ drooling हरु देखिरहेको हुन्छ. Along with these classic symptoms, epiglottitis ma other signs of infection such as fever, malaise, sore throat, यो सबै सिम्पटम्सहरु पनि देखिरहेको हुन्छ. तर NCLEX ले मोस्ट रिपिटेडली सोधिरहेको सिनेरियोजहरु भनेको चाहिँ एउटा ट्राइपड पोजिसन भयो, अर्को डिफिकल्टी इन टकिङ, डिफिकल्टी इन swallowing, and most importantly stridor. Mostly the patient will be presented with muffled breathing sound, and that's how you know the patient is suffering from epiglottitis. So due to the inflammation and all those swelling, the patient is not able to maintain the airway. So हाम्रो major priority अथवा चाहिँ NCLEX ले सोध्ने most important कुरा भनेको चाहिँ maintaining that airway. So airway maintain गर्नको लागि चाहिँ हामीले कि त intubate गर्नुपर्ने हुन्छ कि त हामीले tracheostomy गर्नुपर्ने हुन्छ. And यदि तपाईहरुलाई options मा both intubation र tracheostomy आएको छ भने our major strategy here is to choose the non-invasive procedure जसमा चाहिँ हामीले intubation लाई चुज गर्छौं. So यदि intubation पनि गर्न नमिल्ने गरी swelling भएको छ भने then you will pick the tracheostomy. So first option is always intubating the client. Now let's talk about the major nursing intervention that you may have to choose in your NCLEX or you have to do in case of epiglottitis. So first thing we have to consider is do not insert anything inside the mouth. So already inflammation भइरहेको छ, already swelling भइरहेको छ. So if we insert objects such as tongue blade, oral thermometer, or even obtaining a throat culture is a big no for NCLEX because त्यसले गर्दाखेरि further spasm गराउँछ and further airway obstruction गराइदिन्छ. So you do not want to do that. And the major nursing intervention that you have to focus on epiglottitis is keep that child calm. So यदि patient ने anxious भइरहेछ, बच्चाले रोइरहेछ भने there is a higher risk for airway obstruction. So बच्चालाई काम राख्नको लागि हामीले के मेजर्सहरु गर्नुपर्छ त त्यसको बारेमा कुरा गरौँ. So first मा हामीले सकेसम्म त्यो इन्भेजिभ प्रोसिजर्सहरु गर्नु नै भएन. So यदि इन्भेजिभ प्रोसिजर गर्नु नै छ भने पनि we have to keep the child with the parent. So हामीले चाहिँ उसको केयरटेकर को छ, उसको पेरेन्ट को छ, उसको ल्यापमा राख्दिने हो कि उलाई सँगै राख्दिने हो कि त्यसरी चाहिँ हामीले उसको क्राइलाई कन्ट्रोल गर्न सक्छौं. नेक्स्ट थिङ इज we have to keep that room light. So यदि बच्चालाई अँध्यारो कोठामा राख्यो भने अब बच्चा चाहिँ they tend to cry. So हामीले चाहिँ सकेसम्म रुममा सफिसिएन्ट लाइटिङहरु राख्दिनु पर्ने हुन्छ. नेक्स्ट थिङ इज त्यो बच्चालाई हामीले रुममा कहिले पनि एक्लै छोड्नु भएन. नेभर लीव दैट चाइल्ड अलोन. So यदि बच्चा एक्लै छ भने they tend to cry easily. So हामीले त्यसको लागि चाहिँ सफिसिएन्ट लाइटिङ भएको रुममा बच्चालाई राख्दिनु पर्ने हुन्छ. अर्को कुरा भनेको we do not restrain the child. यदि रिस्ट्रेन गरिरहेछ, बच्चालाई बाँधेर राखिरहेको छ भने they tend to cry अनि त्यसले गर्दाखेरि पनि risk of obstruction अझै बढी इन्क्रिज हुन सक्छ. नेक्स्ट थिङ इज पेशेन्टलाई हामीले काम इन्भाइरोमेन्टमा राख्नुपर्ने हुन्छ. सकेसम्म धेरै स्टिमुलेट नगर्ने, सकेसम्म कुनै पनि एक्टिभिटिजहरु गर्नु भएन, बच्चालाई चाहिँ चलाइरहने, यताउता फर्काइरहने. सो त्यो चाहिँ गर्नु भएन. काम इन्भाइरोमेन्ट प्रोवाइड गर्नु पर्यो with minimal stimulation. So that's how you care for a patient with epiglottitis. I hope this video was helpful for you guys. So if you want more information about NCLEX content, stay tuned for other videos. Thank you. All the best.